We perform echocardiography in the patient with acute anteroseptal myocardial infarction. The left ventricle, mitral valve, left atrium, aorta, aortic valve, right ventricle are visualized. Let's measure the diameter of the aortic bulb. It equals 33 mm. Peristernal short-axis view of the left ventricle at the mitral valve level showing the mitral valve. In this position, the peristernal short-axis view at the level between the papillary muscles and the apex of the heart is presented. The apical four-chamber view. The left ventricle, mitral valve, left atrium, right ventricle, right atrium, tricuspid valve are visualized. We measure the size of the left atrium. It equals 40 mm. The size of the right atrium is 35 mm. Hypokinesis of the left ventricle apical septal and mid-septal segments is visually determined. Left ventricular end diastolic volume measurement when mitral valve is open equals 125 milliliters. Left ventricular end systolic volume measurement when the mitral valve is closed equals 62 milliliters. Left ventricular stroke volume equals to the difference between left ventricular end diastolic volume and left ventricular end systolic volume. Ejection fraction equals left ventricular end diastolic volume minus left ventricular end systolic volume. 125 minus 62 equals 63 milliliters. We calculate left ventricular ejection fraction, which is equal to the ratio of stroke volume to the left ventricular end diastolic volume. 63 divided by 125 is 50%. Pay attention again to the hypokinesia of the septal apical region of the left ventricle. Apical two-chamber view. Left ventricle, mitral valve, left atrium, posterior wall of the left ventricle are visualized. The contractility of the posterior wall of the left ventricle is preserved.